We're all very excited to have you here today and help you find what you're looking for. Dr. Rich is a double board certified facial plastic surgeon. He's performed well over 10,000 cosmetic procedures of the face and neck. He's also the Wall Street Journal best-selling author of the book you were given today. Dr. Rich lectures all around the country, and he takes a lot of media requests. We'll show you some of that video footage in just a moment. Now, if you'll take a second to silence your phones, we'll get started. And now for those highlights.
Castellano is wearing something new.
Dr. Rich Castellano money. Dr. Richard Castellano says laser lipolysis gets info.
Dr. Richard Castellano.
We asked Dr. Castellano to come in to Dr. Rich Castellano. The board-certified facial plastic surgeon is one of the first in the country to use Google Glasses while he's working on patients. Dr. Rich Castellano says that's one main reason behind this new trend. Less expensive, less invasive, cosmetic face procedure. So she turned to Dr. Richard Castellano for an image lift.
Thanks to Dr. Castellano, I just feel like $1 million.
Dr. Castellano says he's seen a spike in patients like Elizabeth who feel they are being discriminated against because of their looks.
Ladies and gentlemen, please give a big round of applause to Dr. Rich Castellano.
Thank you, Stephanie, and thank you, Molly. Please a big hand for our amazing team that put this all together here. It's not easy putting these events together, and we're excited to be here and share with you what we get to do every day. So, isn't it interesting how appearances make a difference in our lives? Wearing this suit, I certainly learned that when I go out, my appearance, people treat me differently. My wife and kids say, thank you, my wife, let's give Marilu a big hand. Thank you, Marilu, thank you, thank you, thank you. My wife and kids, they're so embarrassed, right? But that's one of my superpowers as a dad. And I have found as a physician that we have such important things that we do for people we're really excited to share. People ask me, they say, well, how did you get involved in becoming a facial plastic surgeon? Why did you start doing this? So for me, it started when I was 7 years old. I spent 2.5 years of my life in a wheelchair and on crutches. I had a hip condition. When I was 11, my mom was diagnosed with schizophrenia. It was tumultuous for our family. I struggled with depression through high school and college. My parents got a divorce. But one thing that I found is that if I was spending time around people that looked like they were having a good time, they were laughing and smiling, that made a difference in my life. It lifted me up and it made me feel better. It was healing. And the healing power of medicine has touched my life. We love to share that with our patients. Because as we get older, we get the feeling that we've lost something. And when you can give that back a little or a lot, there's a lot of healing that goes on. And the world can come at us and we feel like we've got to handle this and that and all these things, and sometimes we just need to take a break. We just need to do something for ourselves. So I'm here to share with you, when you are ready to do a cosmetic treatment, which is very healing, patients tell me that I wasn't prepared for how good it was going to make me feel. We are here to help you do it the right way. Have any of you ever gone on to Google to search how to do fillers or facelifts or cosmetic treatments? Has anybody ever done that before? Boy, it is confusing. I mean, there's so much information out there. Some of it is accurate, some of it's not. How do you know? It differs from doctor to doctor. I'm here to share with you my experience of over 4,000 facelifts under local anesthesia. Most doctors will retire after about 500 or 1,000 facelifts. So you get the hang of it after 4,000. I've done over 20,000 syringe and filler injections, so we know what makes people happy, we know how to keep people safe, we know how to do things the right way and keep people looking natural. So by the time you're done today, you'll have a plan, and I know you have filled out your paperwork. Even though there's a lot of people here, we'll put a plan together for you, so my team will set you guys at the tables, they've got them in the back, and we'll sit down, we'll put a plan together that's right for you, because it's different for everyone. And is anyone here interested in how much these things cost? Good, all right, well, we're gonna go through that as well. So we're really excited that you're here, and so there I am, that was when I was on my crutches and living with my cousins, that's my mom and my dad, and there's my smile buddies. My kids have grown up, they're a lot older now, but of course they lift me up, make me smile, make me feel good. Appearances matter, when we look good, it makes us feel good. So we wear these helmets. I wear this is a HEPA filter. It's called a PAPR. And I've had the vaccine, and we are encouraging all of our patients to get the vaccine. There's a lot of interesting information out there, but so far I think over 60 million doses have been given in the United States, and it's definitely safer to get the vaccine than it is to get COVID, but there's no contraindications with the vaccine in any of our treatments, okay? But even though I've had the vaccine, I still wear this just in case. It's a HEPA filter, it filters all the air we breathe, and my team is always raising the standard for PPE and making sure that things are safe for you. So that's why I wear this, for your safety, for our safety, and we have an outside consulting firm. They monitor our practices to make sure we're safe and always raising our standard. So that's what I'm wearing, my little space helmet. Now, we've been through lockdown, the world has changed, this too shall pass, things are getting better. And fortunately in Florida, we have a little more freedom than a lot of other places. But now that the vaccines are rolling out, infection rates are going down, and people are wearing masks, they're saying this is the best time to do a treatment because I'm wearing a mask anyway. No one can see. We are an essential service, so just like people wanted their hair and nails done when they were in lockdown, they want to get their faces done, their treatments with or without downtime or recovery, whatever you choose. Now is a great time to do a treatment. I'm so proud of my amazing team, right? We put on events all around, our socially distanced events now, and they make it so easy for me to do what I do. Because we see a lot of patients, and I definitely couldn't do it without them. And face-to-face or virtually. So now with the virtual capability, if it's easier for you to see us video or you want to come in, you've got some options. So we have expanded our ways that you can access our team. And for my own patients, I get my cell phone number out, but I don't get that many phone calls because we do a lot of preparation. But that way patients feel comfortable, and if they need anything, they can always reach us. So we're going to be safe and be smart, and we're going to do things the right way. So I like to start out by talking about, I share with you my why I'm here. I love to be a healer. I've been healed in my life, and I love to share how we help heal others by doing cosmetic treatments the right way, help people to regain their identity, to feel good about themselves. There is a reason why you are here. There's something that made you pick up the phone or email us and said, I want to be there. Or maybe you got dragged along by somebody, but whatever reason you're here, that reason why is what's going to get you your best result. When we do treatments like this, sometimes when people are deciding, it can feel overwhelming, or sometimes we just get stuck and say, I'm not sure what to do. If you go back to your why, whatever your why is, whether you've raised a family, or you want to invest in yourself, or you have an event coming up, or some of my patients, they want to start dating, or they went through a medical situation and now they just want to feel good about themselves. That reason why is so important because it'll help focus and help us get to the right place for you. So I like to start out with the why. Now, I talk about my ABCs of plastic surgery. When you know the ABCs of plastic surgery, you will know the best decision to make because you'll understand the big picture, okay? So here's how we talk about the ABCs of plastic surgery. A stands for area. There are 4 areas that we address for the facial appearance. Number 1, if we sag, we tighten. Simple, makes sense, okay? Number 2, if we lose volume, we fill. As we get older, we lose volume and hollow, but I can put the volume back. Number 3, sun damage, wrinkles, and sunspots for the skin, we can polish and repair the skin. The 4th area is better than all the others. That's our behavior. None of our treatments look as good as Mother Nature's free facelift when we smile. I cannot outdo the smile. The smile always looks the best, okay? Now, do you know how when you do something nice for someone else, that it just gives you that feeling on the inside, it feels good, you know what I'm talking about? Do me a favor, I want you to turn to who's next to you, or just look up front here and give your neighbor a big smile. Just give them a big smile, even though we're wearing masks, right? You can still see the smile, right? Or painted out here. You can't hide the smile. It makes us feel good. Right? My wife and kids are like, enough with the smile talk. But they're all good smilers, so that's fine. They gotta put up with me. The power of our appearance. When you change your appearance, it impacts other people. But who's the most important person our appearance influences is ourselves. When we look into the mirror, if we feel our hair is done and we're wearing a nice outfit like I'm wearing today, and you look and you like what you see, it makes us feel good. And sometimes we look into the mirror and we look and we're, oh. That's a vocabulary word. Oh. You all know exactly what that means when I say that word. Oh. But we don't like to feel that way when it comes to our appearance. So that's why we're here. So you can, when you look in the mirror, you can say, aha, I like what I see. That is the power of our appearance. So 4 areas: tightening, volume, skin, and behavior. That's A for area. B stands for boundary. What are the rules for good plastic surgery? Hey, Jen, can you help them out? Oh, I think she's also. Jen, can you just give them a hand? Thank you so much. B stands for boundaries. What are the 4 rules for good plastic surgery? Safety's always first. You must look natural. Prevent future aging, and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, it's better than going too far. Okay? So, B for boundaries. C stands for combination. If we want our best results, we combine. We can combine tightening, volume, and skin. That's going to get you the best results. If we want our best results, but we just want to do one treatment, then we talk about tightening. And if we want our best results, but we don't want any downtime, fillers. Now, fillers do a great job, but they don't give us a facelift, right? Does that make sense? Facelifting, I get wonderful results, but I can do even better when I combine. So if you understand those 3 categories, combination, facelifting, and then fillers, whatever treatment you choose, if you're happy with your results, great. But if you want more than what you achieve, you can do more of that treatment, or you take the next step. Does that make sense? You can predict the future, because everyone in the room right now, we have many active years ahead of us, and whatever treatment we choose, whether we choose solo or we want to do combination, at some point as age keeps coming, that is how people decide, right? Does that make sense? The difference between combination, solo, no downtime treatments, right? Okay? A, B, C. D stands for different perspective. Now, we never see ourselves the same way that other people see us, which is interesting, because we're looking at the same thing, but we do not see it the same way when we look at ourselves, because when we look at other people, we look at them socially. We animate and express our face. When we look at ourselves in the mirror, we do not look socially. We look seriously, and we look for imperfections, and it can make us feel bad. Sometimes we're a little too hard on ourselves. Anybody know what I'm talking about here? This is the reason people go too far. If we're too hard on ourselves and we don't have the right doctor to protect us, happens all the time. It's not going to happen here. But that's why we're here to guide you. So does that make sense? The ABCs of plastic surgery? Okay. Give yourselves a big hand. You know the ABCs of plastic. Now come on, give yourselves a big hand. There we go. The people in the outside world, consider everyone else. There's a lot of people out there doing cosmetic treatments. You are way ahead of everybody else, because you know that and you understand that. So when we do your one-on-one, you'll have a really good idea of what is right for you. Now, I'm going to show you some before and after pictures so you can see our patients, and when you see enough pictures, you'll get an idea of what can be right for you. So, ABCs of plastic surgery, we talked about the rules in our philosophy. We never see ourselves the same way that other people see us. So this is Judy. Now, Judy is a family woman. She raised her family. Has anybody here ever raised a family? Right? Who gets put first in family? kids, the dog, everybody else. And who gets put last? That's one of the things that we love about what we get to do, is we get to put you first. We love to give to the giver, right? And we, as givers, we love to give to other people. We love to give to our families. We're not going to stop doing that. But you can't pour from an empty cup. I mean, at some point, we got to give to ourselves. And what's really awesome is when we do give to ourselves, there's a lot more to give. So we love to give to the givers. Judy was a family woman. She gave to her family. And then when her kids left the house, she became a caregiver for her parents. Has anybody here been a caregiver before? Is that easy being a caregiver? Boy, it is hard to do, to be very emotional, hard to get a break. Judy was a caregiver for her parents for 20 years of her life. What an angel. It was great that she could be there for them, but 20 years, that's a lot. And then when her parents passed, unfortunately, her husband fell ill. She was his caregiver for an additional 10 years. After 30 years of being a caregiver, Judy made a confession to her family. She said, you know, I'm not even sure who I am anymore. She felt she was always living for somebody else. Judy made a very important decision. She looked into the mirror, and as she saw herself, she could see the aging changes. You know what she would do? She would pull on her jawline like this. And she liked what she saw. Does anyone here ever do that at home? She liked what she saw. She came into our office. I will never forget meeting Judy for the very first time. You know how when you meet people that have been through difficult things in life, that the little details, they don't tend to bother them so much. Like, you know what I'm talking about? This was Judy, very kind, very respectful, humble, reserved. She came in, she told me about her family, she told me about her goals, and we sat in front of the mirror, and when she was in front of the mirror, I would pull back like this. I said, how does that look? She says, I like it. And I said, some will get a little more, some get a little less. If you like what you see, you'd be a good candidate. She says, I like your philosophy. I do not want to go too far. Now, she brought her daughter with her. So she gave her daughter the side-eye look. You know, just, what do you think? Her daughter said, you go for it, Mom. It's your time. So Judy did a laser image lift. She did eyelid treatment and some filler. And here are her results. So you can see in her neck and jawline how they improved. And under the eyes, there's no surgery under the eyes. That's filler. You can avoid lower eyelid surgery often by just doing filler in the right areas. And you see her neck and her profile. I'm so proud of Judy's results. And when she comes into the office, I love asking our patients, what's the response been? What have people been saying? Well, they can't figure it out. They think I lost weight, or Judy, you changed your hair. Living in Florida has been good for you, Judy. And I'm seeing her, she's standing taller, she's smiling more, she's moving her hands around, and she's wearing colorful clothing. She told me she was driving with her son in the car. Her son was driving, they get a flat tire. He pulls over, he starts to work on the tire, another couple stops to help them, and as they start a conversation with her son, they ask him, how's your wife doing in the car? She loves being mistaken for her son's wife. She told me she had been attending her church, and for the very first time, she became a greeter. Welcome, it's so good to see you. Here, come right this way. Let me get the door for you. We're so glad that you're here. And to see Judy go through all the things she's gone through in her life, raising her family, being a caregiver, going through the loss of her loved one, and she made the decision to give to herself, there was a lot of healing going on. And to see her smile, it was so touching. And it made me realize it is never too late for any of us to invest in ourselves, to do our own self-care, because self-care is healing. When we take care of ourselves, and we all need healing, because this world It can come at us really hard and fast. We've got to take time for ourselves. So it is a true honor that we get to help people in their self-care when they want a little perk, a little lift, or a big perk, but you'll still look natural. This is what we do best. If we can do that for Judy, we can do amazing things for you. So I'll show you another patient. So this is Sally. Now, what was Sally's why? When she would take pictures, this under here, she didn't like that, under the chin. It bothered her, and she wanted to do something about it, but she was very active. She did not want to take a lot of downtime. So she came into the office, we did a lift and laser for her, looks very natural. Look at her. She has a neckline of a 30-year-old now. And she's in her 60s in this picture. And difficult to see the incision location, it doesn't show easily. So we're very proud of her. She brings donuts to the office when she comes in, so we love seeing Sally. Mary came to a seminar very similar to this. What was her why? Underneath the neck, that bothered her, and the smile lines. So we did the seminar. Afterwards, we did the one-on-one, and when I sat with her, we put a plan together, and I said, Mary, this is what I think you're a good candidate for. I'm curious, how long have you been thinking about this for? She says, I've been wanting to do this for 5 years. I said, 5 years? What's been holding you back? She says, I've got these financial obligations and this person I'm helping take care of. She didn't know how she was going to put it all together. She was stuck for 5 years, and then she was able to figure it out. What happened? She met our team, Marluz and Stephanie, and you only need one solution to make it work for you. Will you be amazed how flexible the process can be? If we can do it for Mary, we can do it for you. Just talk to our team and let them know if that holds you back, we can help you out. Now this next before and after I'm going to share with you, it really is my very best result. All of my 4,000 facelift case experience, the latest technology, the power of smile wrapped into one. I'm very proud to share this with you. Did we do a great job? So maybe we can't take things this far, but we'll go as far as we can. And if we need to come back another day and do more, it's better than going too far. Now, I meet a lot of people. So do you think that we ever meet someone that this is what they're looking for? We have to have a talk with them. There's a limit on how far we can go, right? We can't take things this far, we'll go as far as we can. If we need to come back another day, it's better than going too far. So that's actually my daughter when she was in 3rd grade, and as a 3rd grader, she would invite me to her school for lunch. So I would leave the office and bring a bag lunch and meet her there. She had her little lunch box with her juice box, and we would go to the cafeteria and walk around the cafeteria, find a place to sit with her friends. It was so cute. So now my daughter, she's 18, she's applying to colleges, and she drives my 2 younger boys to school, and she does not invite me to lunch anymore. But let's see what happens. We still have some time before she leaves for school. Very proud of her. She's a beautiful young woman. So this is Melba. What was Melba's why? Melba's friend came to our event, did a lift, and when she went back to her activities, because they were floggers, they would dance, Dale did not tell anyone what she did. She didn't tell anyone a thing. Melba saw her and said, Dale, you look amazing. What did you do? You know what Dale said? Oh, nothing. I just had a little pressure. I didn't really do anything. Melba said, Dale, you've got to tell me. You look so good. What did you do? So Melba pushed, and finally Dale told her. She says, all right, I went to Dr. Rich's seminar. He does these lifts under local anesthesia. Dale came straight to our next seminar, or Melba did. She signed up, she did her lift, and we did a lift, laser treatment, we did fillers, we've done a touch-up treatment for her, and Melba comes out to a lot of our events and talks about her experience. So that was her why. Her friend looked so good, and she wanted to do something, and then this area here bothered her. She called it her Richard Nixon jowl. That's what she would call it. She didn't like that. So, and people say, well, do I have scars that show? The incisions, they're very difficult to see. Okay? Very proud of Melba. Jeannie's a nurse. We have a lot of medical personnel that come through because they want to stay safe. And like I said, I've got an outside consulting firm. They monitor all of our practices, make sure we're always raising our standards. So we're very proud of our medical personnel that come through. Martin, he's a golfer out of the Villages. He was in the finance industry. We have men that come through too as well. He doesn't grow his hair long to hide incisions, so you don't have to grow your hair long. In fact, a couple of my friends have come through recently. They're a little bit older than me. And they said people are coming in younger because they don't want to wait for the advanced aging changes. Now, it's never too late to do something, but even my male patients, right? They love the results, looks good, looks natural. Of course, we always look our best when we smile. And you see here, difficult to see the incision location. You see he's got these sunspots here? Those all get lifted up, and he's got such a nice, sharp jawline. Very proud of Martin. Mary. What was Mary's why? Mary would spend time with her grandson, and he would sit on her lap, and they would read, and when they were together, sooner or later, her grandson would reach his hand up and grab her neck. And she hated that. It really bothered her. So she came in and told me this. I said, let's get you taken care of. We did a lift for her. Nice improvement. She was not satisfied. She wanted more results. So what do? We bring her back, and we get a little more. Now she's happy. So if you need to come back another day and do more, that's better than going too far. That's what worked best for Mary. And now her grandson doesn't have anything to grab onto anymore when they spend time. So she enjoys more time with her grandson. Al, what was his why? He wanted to start dating. He wanted to get into a new relationship. He wanted to meet people. He felt people thought he was older, and he didn't want this to make, he wanted to freshen up. So I said, well, Al, you don't need a full facelift. You don't need general anesthesia, no IV sedation, no surgical staples, no surgical drain. You can do the image lift, where you take relaxing medicine by mouth, numbing like at the dentist, lift the skin, tighten the muscle, trim away the extra skin, very tiny little stitches. Okay. That's the image lift. Or some patients will say, I just feel like I want a little less, or it's easier for their budget. We can do the mid lift. Then there's the mini. Now the mini is a great treatment. It's not for everybody. Some doctors won't offer it because they feel it doesn't get good results. But we have a lot of patients that are very happy with the mini. How do you know if the mini's right for you? If someone tells me, this here under my chin, it doesn't bother me, but I like this when they pull, that's someone who may be happy with the mini. Or if someone says, if I do a lift and I still have something under here, I'm not going to be happy, then the mini may not be a good choice, right? So I told this to Al. I said, Al, he has kind of a lot underneath there. I said, we should probably do the image lift or the mid and not the mini. Well, what does he say? Just do the mini. I'll be happy. Do your best. That's what I want. So I did the mini. He got a really nice result. I'm very proud of his result. Now, if you look closely, you see underneath, he still has a little something there. He's okay with that. But not all of my patients would be happy with that. That's why we do the one-on-one. So we'll put a plan together that's right for you. You follow me so far, right? That was the right choice for Al. And when we do the one-on-ones, we'll talk about the right choice for you. Laser tightening. As we age, we lose the elasticity. In the skin, this is 1 day later. No downtime. We can tighten and firm, and you can see how we reduce that area. 1 day later, no downtime with the laser. This is 6 months later for Monica. Monica came on TV to demonstrate her results, tightening the jawline, little filler in the cheek, and tightening through here. Now that's laser tightening, but when you tighten the muscle, this is the image lift 1 year later. Nothing replaces that result. When you see her profile, what a nice improvement. Difficult to see the incision locations. They fade very nicely. But we combine them. So for Judy, I did laser to tighten the skin, lift to tighten the muscle, and lift to remove the extra skin. Deb has a radio show. She's a fitness instructor. She sent us so many referrals. Laser to tighten the skin, lift to tighten the muscle, and lift to remove the extra skin. RJ, she's an actress in movies and television. We did laser to tighten the skin, lift to tighten the muscle, and lift to remove the extra skin. Everybody's result is a little different. Now, if you have your photos in your 20s, you'll see how our volume changes. As we get older, we lose skin, muscle, fat, but we also lose bone, and it can make us a little bit shorter, right? The facial bones can also get shorter, and the facial mask will sag forward, right? So, we can expect that's going to happen. That's very normal, but now we know how to treat it. So what I do is when we're full of volume, and now she's sagging, jowling, and hollow, we fill the hollow and lift and tighten. Combination approach gets the best result for Diane. Katie's a nurse and a figure skater. Look at how full her jawline is here. And loss of volume, sagging, lift and fill, combination treatment. Full of volume here, hollow for Liz, and you see the jowl. Lift and fill, combination treatment gets the best results. Facial sculpting. Most people that do injections, you got to think of the whole city out there, all the people doing cosmetic treatments and all the injectors, most of them are beginners or intermediate level, right? You need to find the expert. This is full face sculpting. I used 16 syringes. We won an award for his result. No downtime, 30 days. That's the Bellafill we used. Looks very natural, not overdone. He's very, very happy. This woman did just one session, 7 syringes, and we took the mole off of her cheek. Laura's a busy practice manager. Okay? And some people just do one area. So we did the smile lines for this patient. She liked the results. She came back 6 months later. Said, I really like my filler, but now it's all gone. I said, well, let's look at your pictures before and after. She looked at her before and afters, and you see, and she says, I didn't realize my lines were that deep before. After we do a cosmetic treatment, our vision gets better and our memory gets worse. When you do a treatment, we look at our faces so closely, and we notice one eyebrow sits a little higher than the other, we get a little more wrinkles on one side than the other. The vision gets better. The memory gets worse because we forget what we used to look like. And that's why the pictures are so helpful. So we keep them here. I have so many patients that come in and say, did I really look that way before? Wow. The vision gets better, the memory gets worse. Laser treatment for the fine lines around the lip and mouth. It's a burn to the skin. It takes 7 to 10 days before you can wear makeup. Laser's not for everyone, but it does a great job for many of our patients. Aunt Shirley did the laser. She also did a lip. She's in her 70s here. And my cousin got married a few years ago. There's Aunt Shirley on the dance floor, having a good time at the wedding. We're very proud of her. Aunt Shirley's been on TV to demonstrate her results, lift and laser. Phyllis, this area on her face, she didn't like it. She had a nickname for it. She called it her waffles. She said it looked like she fell asleep on a waffle line. So we did the lift and laser to take care of Phyllis. Everything in life evolves. If you told people 30 years ago what these devices today can do, what would they have said to you? No way, that's crazy. It's like magic. But not only is it true, these are going to be outdated because they keep making better versions. Everything evolves. What else has evolved? What were grandparents like at the 1900s, the turn of the century, 19th century? Grandparents today, they're active. They're living longer than ever before. Thank goodness for modern medicine. They're taking care of their families. Plastic surgery has also evolved. The tools we use are far superior. The training is way better. The results are superior. It's safer. There's never been a better time to do a treatment. That's why we're here to share what can be done. Sherry was an image consultant. She did a lift. She never told her daughter. Her daughter couldn't figure it out. She's very pleased with her neckline. Jen is here today. You'll hear from Jen. And she's been with us for many years. Helps us to set up these events. Linda did combination treatments. Full of volume, sun damage, wrinkles, and sunspots. We did lift, laser, filler. Very proud of Linda. Nancy is a healthcare provider. Just wanted to tighten up the neck and jawline. Shirley did a lift. Now, I cannot get these kind of results unless I'm doing a lift. I mean, that's a tremendous improvement. And what was even more powerful than her before and after, Shirley was telling us that not long after she did her lift, that her husband had passed, and her lift gave her that confidence, that boost to get her out there again and get active in her life. And now when I see her, she's just so energetic, and it's so tough. You never know what's going to happen to us in life. But let me tell you something, these treatments make a difference for people. A lot of healing going on, and we feel so honored to be a part of this with you and with our patients. I'm very, very proud of Shirley. So what we're going to do now is if we have our models come up, ladies, why don't you come up? Let's give our models a big hand for coming out. So they've all done treatment, and they were in your shoes at one point saying, should I do this or not? The full disclosure is, before Jen works with us, and we pay for our models for their gas money and for them to have a meal when they come out. So Jen, we'll start with Jen. Can you tell us, bring you over here a little bit more. What was it that inspired you, Jen, to have a cosmetic treatment done?
It was 6.5 years ago, and my friends and I were getting ready for a girls' night out. And we hadn't done this for months, so I was spent extra time getting ready. I put on a new outfit I just bought, put on nice jewelry, spent extra time doing my hair and my makeup. And as I walked out of the house to meet them, I glanced in a big mirror in our foyer and saw an old haggard woman looking back at me. So it was at that moment that I realized no matter how hard I wasn't going to look good again. As a matter of fact, I really looked haggard. That evening, I was talking to my closest friend, and I said to her, man, I need a refresh. I said, I'm looking haggard and I'm losing my self-confidence. And she turned and looked at me and said, what are you waiting for? She went on to offer some great advice. She said, think of it this way. Today is not a dress rehearsal for the rest of your life. Today is the first day of the rest of your life. That someday out there is today. Her words were a defining moment for me. Shortly after that, Dr. Rich did a facelift procedure for me. I absolutely loved the results. I felt so empowered. I got my self-confidence back, held my head up higher, and was now proud of how I looked. That was 6.5 years ago. Fast forward to this past December. Dr. Rich did a refresh mini lift for me. I had started to get some loose tissue on my neck and my lower jawline, and he tightened that up. And I'm calling it the new year, new me. Once again, I'm now proud of how I look, holding my head up high. And as Dr. Rich mentioned, I've worked for him for many years. Actually, this upcoming summer will be 12 years. So over the years, I've seen hundreds and hundreds of happy patients, and I too am definitely one of them.
Can you say how young you are with the audience?
Yeah, I'm 68, will be 69 in a few months.
So, I mean, this is not the picture of 68 turning 69. So proud of you, Jen. Thank you for sharing. Mel and Linda, thank you for coming out. Everybody looks so nice. Mel, can you share with us what inspired you to have a cosmetic treatment done?
When I was in my early 50s, can you hear me? When I was in my early 50s, my face started falling off, hanging off at the jawline. I mean, my neck was just sliding off my skeleton. Anyway, I did start doing research. I started seeing plastic surgeons years ago. I mean, this was a long time ago. So I saw plastic surgeons in Texas. I saw plastic surgeons in Alabama, Mobile, Alabama. I came to Florida and started searching for a plastic surgeon. I went to 2 different doctors, one in Ocala, one in Orlando, and then I found Dr. Castellano. I mean, all of these other plastic surgeons scared me to death. I mean, there was no way I wanted them to do any work on me. So I just kept letting my face fall off course. So when he did finally do my neck, my mid lift, I was 64. I'm 70 now. And I gotta tell you, he gave me back. I mean, I did research. I wasted all those years looking for Dr. Castellano, and I finally found him. Thank you.
Thank you, Mel, for sharing. And Linda, thank you for coming out as well. Linda, what inspired you to have a cosmetic treatment?
Melba inspired me. I work at the gym on top of the world. She lives there. I live there now. She came in and told me she was going to a seminar because her neck was falling off her face. And so she had her procedure. Dr. Castellano made her look beautiful. So I decided to go to one of the seminars. So I had a lot of sun damage on my face, so I had laser resurfacing first, and then I went back a few months later and had the Bella filled. It's been the best thing for me. I had two, 2015, I've had a few more since then. It really gave me self-confidence to feel good about myself. I would have never gotten up here and spoken to people and let them look in my face before Dr. Castellano, so he's been a godsend for me. Thank you.
Thank you so much for sharing, Linda and Mel. They're like part of the family, right? It's always so good to see them, and it never gets old. When somebody needs something done, we can take care of them. It really is a wonderful big party, and like I said, we go back to our goals. We're gonna keep you safe. You're gonna look natural. We're gonna prevent future aging, and we're gonna give you as much improvement as possible. So here's what's gonna happen now. My team is gonna start with the one-on-one. Even though there's a lot of people here, it doesn't take that long. So before you leave, you'll have a plan that's right for you. But before we start that, one more time, just emphasize how important the power of appearances is. Turn to your neighbor one more time, just give him that big smile. Go ahead and turn this over, look up here, give him a big smile, because that feeling we get on the inside, that is a part of what we do. When we look good, it makes us feel good. I thank you for sharing your smiles with me. Everything worthwhile starts with a smile. I look forward to meeting you soon. Thank you for your attention.